And now the clinical features. Imagine your thyroid gland as a generator that provide energy like electricity to run all the system, your organ, your muscles and brain. In normal state, the generator, that is thyroid gland, runs smoothly and steadily, produce just the right amount of electricity, that is heat, to keep everything working perfectly. But in hyperthyroidism, something goes wrong. It's as its speed control knob of the generator is turned up too high and jammed there or stuck there. And now the generator keeps spinning faster and faster. That is, thyroid gland is overworking and flood every system with excess energy. So what happened in case of heart? When the generator runs too fast, it sends too much current to the circuit, controlling the heart. The heart starts racing, that is, increase heart rate or tachycardia. It pumps more forcefully, so there is increased contractions, which lead to palpitation. The circulation is speeding up, leading to the bounding pulses and warm skin. Patients often have exertional dyspnea. In severe cases, the overwork causes arrhythmia like atrial fibrillation. The thyrotoxicosis can cause a thyrotoxic cardiomyopathy because of increased working of heart. And the onset of atrial fibrillation can precipitate heart failure. Echocardiogram revealed pulmonary artery hypertension in about 40% the hyperthyroid patient. Even subclinical hyperthyroidism increases the risk for atrial fibrillation and overall mortality. The hemodynamic abnormality and pulmonary artery hypertension are reversible with the restoration of euthyroid. And metabolically, the overactive generator produces too much heat and energy. So there is heat intolerance and excessive sweating. And there is weight loss despite increased appetite because overworking generator burn energy too fast. There is fatigue as machine overwork, the energy drained. There is muscle weakness, especially in thighs and shoulder. In nervous system, the extra electricity overstimulates the brain circuit, leading to anxiety, restlessness, irritability, tremor in hands, fine shaking from the overcharged nerve. There is insomnia, there is hyperreflexia, reflexes are exaggerated. In GI system, the too much of energy also speeds up the gastric system, so there is increased appetite, body constantly demanding fuel. There is increased bowel movement or diarrhea as gut working too fast. In case of skin and hair, as the machine that constantly hot to touch, radiate heat outward, so there is warm, moist, smooth skin due to increased blood flow and sweating. There is flushing and a reddish complexion of the skin. There is fine, soft hair, but the hair loss due to rapid turnover. In case of skeleton system, as overworking machines consume not only its fuel, but also start wearing down its own internal parts, so the bone resorption exceeds the formation, leads to osteoporosis and fracture risk as high thyroid hormone increased bone turnover. In case of eyes and skin, as in hyperthyroidism, particularly in grave disease, the immune mechanism lead to activation of fibroblast in certain tissue. The activated fibroblast increase the synthesis of glycosaminoglycans. Glycosaminoglycans are highly hydrophilic. They attract and hold water. As these glycosaminoglycans accumulate, they cause edema in the surrounding tissue. When edema builds up in retroorbital space, it pushes the eyeball forward, producing exophthalmos. Similarly, the same process occurs in the skin, especially over the shin. It results in pretibial myxedema, that is dermopathy. This is more common in patients with high level of serum thyroid stimulating immunoglobulin and severe grave disease. In both hypothyroidism and in grave disease, there is activation of fibroblast and accumulation of glycosaminoglycans causing myxedema. But the mechanisms are distinct. In a reproductive system, because disruption of pulsatile release of GnRH because of decreased free level of sex hormones. So in case of female, there is oligomenorrhea or amenorrhea, infertility, and increase the risk of spontaneous abortion. And in case of male, there is decreased sperm motility, decreased libido, and erectile dysfunction, which we already discussed in previous lectures. In some people, especially in Asian, a rare complication of hypothyroidism can occur called hypokalemic periodic paralysis. Hypo means low, kalemic means potassium in the blood, and periodic paralysis means temporary weakness or paralysis that come and goes. Because of overactive thyroid hormones, the body's cells pull potassium out of the blood and trap inside the cells. So blood potassium levels suddenly drop, leading to hypokalemia, even though the total amount of potassium in the body is normal. This low potassium interfere with muscle function, leading to sudden weakness or paralysis, usually in both sides of body and mainly in arm and legs. These attacks often happen after eating a lot of carbohydrate like rice, sweets or sugar drinks, or after vigorous exercise. That's because both carbs and exercise make insulin goes up, which push even more potassium into the cells and making the blood potassium level drop further. And sometimes it can also happen after getting intravenous glucose. And this paralysis can last from few hours to as long as 2 to 3 days. And that gradually goes away as potassium level return to normal. And is much more common in men's, about 30 times more common than women. These people may not look like they have typical hyperthyroidism signs. Along with low potassium, there is also low phosphate in the blood. And these are the few clinical signs and symptoms of hyperthyroidism.